Namaste, and welcome to our continuing series on homeopathy with our beloved Dr. Pachegaonkar. Today we will complete our talks on injuries. Can we start with nerve injuries?
See, the whole body is communicating with each component with the central system through nerves. And not only that, our system is receptive to external environment through these nerves. So all over the body we have rich network of nerves. So any injury to these nerves is bound to be painful because any pain is communicated through nerves. Now, especially in injuries where there is a fracture or gross, what we call injury on tissues, the nerves do get injured. And depending upon the location and the type of injury, we have to select a remedy for it. Commonest nerve injuries would be like post-operative. When one is going for a surgical operation and surgeon is approaching particular organ which has to be intervened, while approaching itself there is network of nerves which gets cut or injured. So we have homeopathic remedies like hypericum is a plant, Staphysagrea, colocynth, ledampal, these are all the plant remedies given in potency. We have seen that these nerve pains are taken care of very efficiently. So there are few surgeons who are routinely using pre-operative and post-operative homeopathic remedies to relieve the pain.
Pre-operative also.
Pre-operative also means in anticipation they give like pre-operative. What we do is we give aconite if there is an acute fear in the patient. If there is little mild nervousness before going for surgery, we give gelsemium like remedies. Then what surgeons do is they paint the area of incision with calendula and hypericum.
Oh.
In anticipation. It's a local herbal antiseptic. So it's a mother tincture with almost 63% of alcohol it contains plus the extract of this plant. And surgeons have found out that the healing of the surgical wound takes always with first intention. That means there is no secondary infection. So along with nerve injuries, we have this calendula which helps in preventing any infection. At the same time, hypericum takes care of the nerves getting cut during the surgery. But we have Staphysagrea like tooth extraction. Tooth extraction definitely involves the cutting of nerves which are supplying the tooth. So there also Staphysagrea helps immensely. Then there are certain stinging wounds like sharp wounds, incised wounds we can see. Even ledampal is wonderful remedy for such nerve injuries.
So a knife cut or something like that?
Yes,
Razor cut?
If it is a razor cut or knife cut, we invariably give hypericum. But if you feel that even the main nerve, main branch of the nerve is injured, then we add Staphysagrea to it. We give locally as well as internally. Local painting of or spraying of hypericum plus internally we give in potency like hypericum 30C. This is the commonest potency which we use, and it's really helpful.
Are there any
But
other?
in like if it is a head injury and there is concussion, and if our brain has some issues there, concussion either it can be like intradural hemorrhage or extradural hemorrhage where there is lot of accumulation of tissues in the nerve in the brain, and that is causing pressure and affecting some area in the brain, and depending upon what area is having that lesion, the symptoms will be there. And I have treated one case of complete aphonia, where the person lost voice, he couldn't even utter a word. And we gave natrum sulf, which is the best remedy for cerebral concussion, and he recovered within 3 days.
Oh, really?
Yes.